at 3 minutes after the top of the hour, and we're really glad you're here. If you want to put in your name, and welcome, Quantrilla or Quantria. How do you pronounce your name? I want to make
It's
sure
Quantrilla.
Quantrilla. Okay, thank you. I want to make sure I got it right. Nice,
Thank
nice to see
you.
you. We really appreciate your comments along the way.
Mhm.
Welcome to the call. I like getting people's names right. So I'm going to put my name in and where I hail from, and then we can use it for a model. Even though probably I know I spelled my own name wrong. Whew. All right, I think we're close. Yeah, we're close. Here we are. We don't have, oh, it's the off-cycleness of it, probably. That might be tricking people, their Ashan attendance, but we all are here and we're gonna get going, and for posterity's sake, this meeting will be available on the Confluence. Remember, this is an informational meeting. The work happens by reviewing the master lists and getting ready to come back for the vote on November 20th. All right, let's get off. Next slide. Every meeting, thanks for joining. I already said that. Everyone's muted upon entry, but especially with a small group like this, there's going to be lots of conversation. Calls are recorded, and that's what I was mentioning. So if anybody needs to review the topics and conversations in this final end-to-end review meeting of our fall cycle, the recording is available on the Confluence in our on the meeting page. We do chat a fair bit, so just send your chats to everybody, and we'll try to stop and have conversation. Next slide. We are, as an HL7 accelerator, bound to follow ANSI antitrust practices as part of our requirement. So participants can't discuss pricing or others' pricing or anything affecting pricing. And we take a pretty general approach. Usually in this meeting, nothing even broaches that to at all, even remotely close, but just as a appointed process, we avoid anything that might be construed as an antitrust violation. Next slide. So the agenda is as it has been, brief welcome and announcements, and then end-to-end review, our final end-to-end review meeting. Looking forward to the vote in a couple weeks. Next slide. Next slide. I want to formally continue to invite everybody to the technical work stream call. There's lots of really cool stuff going on there. What the team is working on in the STU 3.0 is lots of innovative new use cases and purposes, really driven by the Social Care Voice co-design project and member priorities above and beyond the original use cases and purposes of our IG. So fun stuff happening over there. Please do join the meetings from 1 to 2 Eastern Standard Time. We've had quarterly implementation affinity meetings throughout the 2025 focused on return on investment. I don't have the topic here, but I can tell you the next meeting is November 20th. We're going to be focusing on a payer member high mark and 3 different windows on return on investment, addressing social determinants of health, social needs within their programs. And we're also going to be having a little roundtable, just trying to close out the year, focusing on payer and vendor platform perspectives on addressing social needs and return on investment regarding actual cost of care savings. So either PMPM, like per member per month savings, or total cost of care. So just a quick roundtable again to kind of close out 2025 and look forward to 2026. In terminology, the biggest update really is that we still are hoping that everyone sends in any letters of support or thoughts on the toxic stress submission that was presented at the September IC10 CM Coordination and Maintenance Committee meeting. The comments are live until November 14th. All instructions about how to do that and what to comment on and what we submitted is available on the Confluence as well. We even made a draft letter for your use to use as you wish. And again, the toxic stress submission really focused specifically on adverse childhood experiences, ensuring that each of the core 10 adverse child experiences as identified by the Kaiser Permanente and CDC study are capable of being represented in ICD-10 CM terminology. So very focused submission, filling critical gaps. Next slide. Any questions on announcements? All right, we're going to keep going. This is a lean, mean, end-to-end review machine today. Only new things. Next slide. And this is us. We are Gravity Project. You are Gravity Project, a collaborative initiative with the goal to develop consensus-driven data standards to support the collection, use, and exchange of data to address the social determinants of health. Next slide. We wouldn't be what we are without our sponsors. As an HL7 accelerator, we are financially supported by sponsorship. And so the entities you see on this slide commit resources to make the mission go. And we are, right now, I'm hoping more sign up, the only HL7 accelerator that has the designated membership model to represent the voices of direct care community-based organizations and patients. I'm super grateful. Next slide. Here we are. So there's a couple things to note here. It is November 6th. This is the final end-to-end review meeting on our 3 fall domains: access to green space, community food access, and neighborhood safety. End-to-end review, we're going to be talking about what we do there again in a couple slides, but it's really important that we all acknowledge a couple things. Number one, any formal end-to-end review comments we need by November 11th, just this Tuesday, because we have to ensure that we get a final end-to-end review SME reviewed master list for the consensus vote on the 20th in time. Right, so if anyone has any final comments and end-to-end review, please send them to us by Tuesday. We, again, just want to make sure we get everything tidy for that vote. And you can submit, Sarah Bahal's putting the instructions, you can submit end-to-end review comments via email, and there's instructions on how to do that are going to be on a future slide. But again, that date, Tuesday, November 11th, is really important. And there's also another, well, actually, there's 3 important things on this schedule of activities. We're having an off-cycle meeting. We used to, in the spring, have an enhancements meeting alternating with a domain meeting. And our enhancements call was focused on the coding for food work and the program classification and program enhancement work. We're kicking that back up again next week because we need to reconvene all our subject matter experts and members and technical experts in the community to talk through some of the options about how we represent the classification and terminology and possible like technical standards. And so we just need to all sit around a table and have a conversation, and we want to do it in an open format, centering as many voices as possible. So next week, same time, same place, same link, the enhancements call will kick back up just for program classification, implementation considerations, really, how we build and represent the Gruber concepts and program concepts, and how we represent the logic of the classification. Sarah Bahal maybe already has posted to the classification page on the Confluence the final version of the classification, which we had, there was the vote, there was the draft we voted on in the spring. And then there were some voting comments that we had to adjudicate. So the same way we do anything, if you submit a vote with comments, we have to adjudicate them per our consensus process. So we finished that, and Sarah Bahal just posted the link. So if you want to look at the classification in advance of that November 13th meeting, it's there. And then so number 1 is the end-to-end review comments due November 11th. Number 2 is next week's off-cycle meeting focused on technical and build questions regarding program classification options and member-centered review and community review. And the next thing is the vote. So in 2 weeks' time, we will be coming back for our consensus vote on all of the community domains we did this fall. So please be sure to come back to that meeting. We'll have instructions for how to get an absentee ballot if you're not able to come. Again, the source of truth is always the master list, so everything on the master is what we vote on in that meeting. And again, I think we've had a pretty robust and constant master across most of our domains for some time, as you'll see, because we're only presenting new concepts today. Any questions on when final comments are due for an end-to-end review, on the off-cycle program classification meeting, or on aspects regarding consensus voting. I don't see here. I'm trying to look. All I see is Sarah's links, so in comments. I don't see anything else except for lovely introductions of who people are of friends. All right. Next slide. Thank you, Denise. Go team. Again, everything about being aware for the consensus vote depends on reviewing the master lists. Right. So also the best way to review, I mean, the only way to really thoroughly review for end-to-end review is by looking at those masters. So again, everything's available on the Confluence under the terminology workstream, under social risk domain build, under the domain of reference, and it's right there. Domain data elements. Click here to download draft food access master list. Right. So on Tuesday, this is why on Tuesday, we're going to be posting the master list from this meeting. And if there's any quick edits and changes we can make an end-to-end review, we'll make them then. And then very shortly after, we'll send a message when we have our final master list. It might just be a week before, but we're going to be trying to get that master list to you for the consensus vote as soon as possible. And we'll communicate it by the listserv. Again, if you need for the vote, we're going to go into that later. So this is a lot of procedural stuff, but this is classic end of domain stuff. We do want the voting people. We do want to make sure that you're registered as a committed member because we develop our quorum for voting on committed membership, and all the instructions you'll see later in the slides, but you'll also see on the master list, on the Confluence. All right, master list posted Tuesday for review, and please do review them because that's how we have a good vote. Next slide. Okay, end-to-end review. We're going to do this one more time. Is really after the proliferation of concepts that happens early, really kind of like in the second quarter of our domain build, an end-to-end review is a time that things start to stabilize, and we ask questions like, are there missing concepts? You're going to see our largest bulk of new concepts come in the neighborhood safety domain, where we really did not have enough macro community level structural concepts to match the evidence. So we had to go back to the literature you all have seen before and pull in some of those. There's not a ton of other missing concepts and new concepts that we've identified, or our SMEs have identified, or you have helped us identify so far in your comments. The next end-to-end review element is, are there incorrect concepts that need to be changed? There's sometimes, we just had an update on one of our concepts for neighborhood safety again, where we needed to change a word that we didn't change, that we forgot to change relative to changes we've made in other concepts. And then we also ask if things are necessary, need to be removed. We make some pretty critical, prudent choices about what is necessary in this phase of work, and try to consolidate concepts into grouper concepts, just like we do in the classification, to try to make things simpler, right? So these are the things we ask, and you all are welcome to ask. If you have edits or comments, they do have to be submitted via email, and we need the rationale and evidence for the suggested alternate approach. And again, thank you so much to everyone who's offered consensus comments and end-to-end review comments so far. We've been doing consistent adjudication through email with members of the community over the course of really the last 4 weeks is when it started to pick up. All right, again, they're due by end of day Tuesday, November 11th, end-to-end review comments. Any questions on this? All right. This is, this end-to-end review silence. It's very common because we've done a lot of talking. Next slide. This is a busy slide, but it's an important slide. We also wanted to make sure that we really clearly showed the consensus voting process, given that our next meeting is the vote. So Gravity Project uses a consensus process to finalize project documentation deliverables. Consensus is the value, like a core value of HL7 and other ANSI accredited organizations' governance processes. And this is where there's a link to join the project. So there is a level of investment that we need to have in order to vote on the deliverable. We've been talking for some time on using HL7 JIRA ticket voting and doing things more formally that way, but still in terminology, we've been doing it this way for some time. So if you join the project as a committed party, you can vote. And then during any consensus voting period, committed parties, when they do their vote, they're going to be asked to vote on the project documentation and deliverables. And all individuals can submit votes or comments, but consensus is calculated again based on those committed parties and the subject matter experts. And then we are committed, just like you heard with the classification, to resolving any objections or yeses with comments in a timely manner after the vote. So on November 20th is our final meeting until we come back in February for the next cycle. Anything that has to be resolved, we resolve after that period in a period of reconciliation, basically. So consensus vote occurs in November 20th, but if you're unable to attend and would like to submit a vote, you can get an absentee ballot. We'll just send you the survey. Any questions on this page, right? Committed part, most importantly, know that to vote, we want you to be a committed party. Most all of you come to all the meetings and are committed parties, right? And then committed parties contribute to that vote, and then we resolve any comments after the vote and that for the final deliverable. Are we good? This is such an administrative meeting up until now. It's about to get into the content, I promise. Okay, next slide. I think we're good. Woohoo! Okay, so we had a very dense meeting last time where we just discussed so much. So last meeting was the classic, almost like penultimate N10 review meeting where there's a lot of new things. So due to the extent of material we've had addressed and that we have to address today, and just trying to focus the conversation, we're again only focusing on newly identified concepts, definitions, and terms in the meeting today. If anything is established and you've seen it in previous meetings, it's on the master, right? And this is just to drive folks to the master, hopefully. I saw, it looks like Susie Hall did her homework. Susie, I'm just so grateful for you. So just know, again, if you ever have any questions on what's on the master, we are able to answer them, but also every single meeting we've had on all of this content is available for review. The end-to-end review meetings are really where the meat of, discussion has happened over the course of our months of working together. Next slide. Any questions on the process of end-to-end review and what we're looking into heading to the vote in a couple weeks? Okay, looks like not. So now we're into content. Next slide. Next slide. We're just going to briefly discuss some updates to community level interventions that we've had. We presented last week really on a level setting on what it means to have macro level interventions as a core part of nursing practice, of clinical practice, of social work practice, right? And we talked about needing to update our intervention framework to allow for those macro level interventions. So this is what we have so far. And we added adjustment, I think it was, in 2023 after the NASM report included it as a way to intervene. And then we added promotion when we did our work in protective factors, because that's how we focus on protective factors, is we just work on identifying them and promoting them. And we have some additions we have some additions that are in proposal given the community level domains and the kind of macro level work that they require. So next slide. So you saw last time definitions and concepts for develop and maintain, because given that the focus of community level intervention at the structural level is program creation, advocacy, maintenance, running, and they're built off of the profession of community development, which is a profession that enables and supports all of this work. We presented a community develop and maintain last week. When our SMEs looked at them, they felt like they wanted to call in a couple specific concepts that are actually really critical. The first is assessment. Every single one of our subject matter expert groups has identified that assessing communities' needs is a necessary first step. And we have assessment as part of our intervention framework, but they felt like it was really important to call it in specifically within the way we do community needs assessments And so builds off of many of the multiple definitions of assessing community needs and community needs assessments. We're bringing an assessment of community needs, which is, again, assessment's an existing concept. We're applying it to the community level, which is the process of identifying the strengths, assets, needs, and challenges of a specified community. Janice.
Yeah, thanks. I would just add to this the challenges of a specified community with the community. So the only thing that's missing there is the community itself, right? Like
Oh, you
some,
mean the collective process. I hear what you're saying there.
yeah, it's like assessment on, not with, kind of. It looks like to me, it reads to me like.
I hear what you're saying, and we have the with conveyed. So this is specifically pulled from the Ohio State definition. I know that there's a definition that includes that with, and thank you for calling that out because you're correct. So correct that actually in the next topic, Janice, the SMEs Act, also said that we couldn't do it without naming that community engagement was critical, right? So involving the community as a continual process to achieve long-term and sustainable outcomes, processes, relationships, discourse, decision making, or implementation, right? So they said even if develop contains topics of community engagement, it's not enough. They wanted it called as a specific, collective action toward these macro level interventions. So I promised Janice to try to find a better definition for assessment of community needs that ensures that it's with and not about. And that should be fairly easy. Again, so we develop and maintain came in last meeting. Assessment of community needs and community engagement are coming in this meeting. Assessment of community needs can better name that it's with the community, not about community. And then community engagement is specifically called in to represent that as a necessary thing that's across every single one of our domains and all kinds of community work. All right, next slide. Thanks, Janice.
Sarah, could you just remind us, we define community somewhere?
We don't use community a lot here. We can define it. We've talked about that. We stepped away from using community in our geographic area concepts, but I hear you. We use the word community a lot, and we will bring in a definition. We don't use it specifically by itself. Lucy, I think that's probably why we've been able to not define it for itself.
I guess when you're talking about community engagement,
Mm-hmm.
it does immediately, for those of us who have done a lot of community engaging, it does immediately raise the question, who is the community at issue for this particular question or that particular domain or whatever?
But isn't it defined by the work? I mean, again, is it prescriptive?
No, it doesn't need to be, but actually what you just said, community should be appropriate to the work that you're doing.
Correct.
I mean, that's pretty blunt, but I don't know, maybe we should make clear as Gravity participants that we expect people to be thinking about what is the community relevant to what you want to think about, or what you need help with, or who you think needs help, or who you think needs to be engaged. And just a general statement like that without at all being prescriptive about what we think community is, but you think about what's the appropriate community depending on what you're doing right now. Okay.
Well, I think also like it's that definition of community is so woven into so many of our models, you know what I mean? Like that philosophical, I'm using your word, Lucy, philosophical. That approach, right, is so core to every single one of the models we've used along the way, but we haven't named it specifically as like a principle, which is, I think, something we could do. Owen, any thoughts before we go on?
And what I reinforce what Lucy say, I gave me a little bit of fear in my heart when we don't have that, and the reason is because many projects usually when they get developed, plan, applied, plan, and implemented, do not have the representation all the community members, and they could be the federal, or they could be the mothers of the neighbor, you know, um, because there is link also with roles and responsibilities and accountability. So
Yeah.
like if you have a project where strategies are linked with the federal and housing, and we don't have housing, you don't have the community in that representation, even though we also believe the community is the neighborhoods and the people, but also, which is true, we need to have that, but also we need to have, in terms to like a role and responsibilities and accountability to make sure the projects get the right input and buy-in, and
Yeah, so actually, Owen, that relates to something that we've defined for the first time in this work as an evergreen concept across all of our, it's coming, that was brought up when you mentioned this last week. There's something coming soon. And then I really just hold on, because some of that how it takes shape and what it looks like when you're doing the work is coming. And then Corey, I love this question. So Corey's asking, does dismantling harmful community level activities things have a place in the intervention framework, or is this included in develop? There's two lenses there's a lot of there's a lot of ways to look at that. I would say a lot of the types of resistance that we are, and activities that we're naming in these concepts includes dismantling harmful things. And we also are trying to take, in much of our concepts, strengths-based perspectives that don't focus just on the negative aspects of what's happening and focus on where, like, the future we want to go to. That was all the work of the Prevention Institute. I don't know if I've answered your question, but is there anything else you want to say on that, that I can?
No, and I can't even, thanks, Sarah. I just thinking just sort of logically where there are
Yeah.
gaps, perhaps. That's really, I don't have any specific examples, but just a
Yeah.
question.
Yeah, so I'm going to take that one back to the SMEs too and see what we think about it, but I really appreciate it. It's a great question. It is a really good question. All right, I'm going to keep going, only because, Owen, what I'm about to say is so closely related to what you just said. So, and Lucy, maybe this actually helps to address some of your concerns, because we were talking about this last week. Next slide. So this is a very dense slide, right? So one of the things that the develop, per our syntax, goes in front of things. Like, what do we want to develop, right? What do we want to maintain, right? And we had to come up with a whole bunch. We sat with the SMEs last week, really, and said, across our person level work, we have a bunch of consistent programs and professions that are always in, right? And our SMEs very clearly said that those were okay, because person level interventions, those micro interventions, are still important. But there was a core, like a similar set of evergreen macro level programs that should always apply as well. And I know it might sound confusing, but if you've ever looked in our work, it's like refer to community action agency, or community action agency is in every single value set we've ever made for interventions, because referring to a community action agency is always a good thing to do. Same thing as like community health worker. So similarly, from a macro lens, a community action agency is also a great thing to refer to when it comes to collective action and macro level interventions, but there's other things also that apply. And Lucy, I like this suggestion here. I love that. Great. Okay. Thank you, Lucy. So these are, I'm going to read through them because, again, this is all new. So we talked about this, Owen, last time. Like, what does it mean to actually build community with intention to do specific work along these lines? And the best concept for that, like, what am I developing, is the concept of accountable communities for health. So what are accountable communities for health? They're structured cross-sectoral alliances of healthcare, public health, and other organizations that plan and implement, I think there's an S there that I put in there by mistake, that plans and implements strategies to improve population health and health equity for all residents in a geographic area. They're designed to strategically leverage resources across sectors, and and that's to address that despair, like, the scarcity model. The ACH model presents tremendous opportunities to reduce costs, enhance quality of care, and improve population health. Lucy.
The next bullet. So you go through the next bullet and I have a comment on it. Thanks.
Okay. So, oh yeah, so I love the word co-designing. That's great, Susan. Sorry. Sorry. Community participatory design. So, so on a community engagement. So Susan, I was looking for a good word. Co-design is lovely. So thank you. On community participatory design, a collaborative planning and designing process in which community members actively engage alongside professionals, institutions, or policymakers to co-create solutions that address, sorry, that address is repeated there, that address environmental, social, or health-related challenges.
So Sarah, you've really influenced at least me to acknowledge that there are always challenges and problems and issues, but there are always also strengths and imaginations and visions to also identify. So could this be potentially modified to say, to co-create solutions that address challenges and identify strengths and resources to do that? Or something along those lines? Because part of participatory design to me would mean not only, hey guys, what do we have to fix here? But also, hey guys, what do we have to build on? What do we have to build on here? I mean, that's what you've been drumming on for quite a long time now.
Thank you, Lucy. I'm gonna let Asha, I know that you like to focus just on instruments, but not just. I mean, she's so crucial. So we are required to go off of some base, like definition and reference when we do these concepts. So our ability to shapeshift them is a little limited unless there's a different reference we can find. But I hear you, right? I hear you.
Yeah, heard.
Heard. Yes. Asha's just coming on to say heard.
Well, you can tell the Prevention Institute, we love your definition and we've added to it and we want to cite you as Prevention Institute amended with permission,
Given that there are subject matter experts across multiple domains, I think that sounds great. They're right
Okay.
here. They're like,
Thank you.
they're right.
Okay.
I see Rob's question. Oh, and I'm going to answer because Rob put first bullet, accountable to what? I'm a little, help me understand, because they're accountable for improving population health and health equity in a geographic area. Accountable is, I don't know if I understand the question.
No, we need in the definition to say accountable, how the accountability is actually made accountable, right? You have to, if you say something's accountable, then you have to have a way of being able to actually determine if it's accountable. Conformance,
metrics.
assessment, metrics. Otherwise, it's not accountable.
No. So Susan, accountable communities for health are not the same thing as the accountable health communities model. I know it's very confusing. Accountable communities for health came before AHC, right? And certainly all AHCs are not ACHs. Right? Does that make sense? So like accountable communities for health are like a goal of like how we do this work in the best way.
Yeah, or there's a metric that is that the community determines how you assess that they are accountable. I know that this phrase is used a lot in healthcare in a way that I don't like because it's not accountable. So it'd be nice if we found a way to actually say that you're accountable in a particular way.
Yeah, so I mean, certainly one of the ways that we do it the most is through improvement in key metrics as established by community health community assessments.
Perfect.
Right?
Find that definition and use it.
Awesome. Right. Yes.
Yeah.
The
Sarah,
community
my,
sorry, yeah. Hi,
I was just gonna
Stephanie.
say my raising hand function doesn't seem to be working.
Okay.
I just think it's important to clarify since, you know, I mean, I've been involved in the healthy community movement since the early 90s in multiple names and multiple structures.
Correct.
But because a lot of people were in that CMMI model and the communities across the nation, including I was in one, it's just important to clarify terms. And so I was just trying to understand if you were trying to have it be different, or if it was a play on the word, or if it's a new term that you've come up with, because just that order of the words is unusual. In all the years I've been involved in this, I've never quite heard it expressed that way.
Yes, okay, so it predates AHC. We'll try to be clear there.
Yeah,
Yeah.
it would, you know, and even in the early days of, like, I led community benefit planning in San Antonio.
I know you're so
And
great.
all of that, there's so many layers here of how we've done this. So I think that one especially just needs a reference point.
And my reference point, what do you mean?
Well, if it's either a reference point in time of how the term has evolved or where you're sourcing that reference from. Like
Yeah.
if it's the Prevention Institute, but how long that term has been, because all the other terms are very standard. It's just that that one is a little bit unusual.
Okay, we'll do a little work on it. I hear you. I hear you.
Thanks.
Especially given the overlap, right? Like again, if it's the same words as AHC and ACH just flipped, I think it's important to clarify that. So thank you, Susie. Oh, and any other thoughts? You've had your hand up so sweetly. Okay.
I was waiting patiently,
I
don't
know, I
worry.
know.
I wanted to agree with everything they said before, but also reinforce in terms to the word accountable. And the reason is because federal, state, and local, nonprofit, for profit, right? Healthcare and public health, accountability is a very complex thing. The problem is we depends many times how efficient and good each one is to produce the health outcomes that we want in the community. Healthcare is a monster in terms to accountability because they have many uh, processes which CMS help a lot. Public health is kind of different because it's every state, every governor, every, it's different, the accountability. But we need the accountability. So that's the first part, right? There's somebody talk about the tool and everything, right? The second part is I see it in terms to accountable and community partnership is what is how we are solving the problem. Because if you are accountable and you think that solving the problem is let people to be healthy by themselves because they are self-sufficient, or you have to have some structures to support that. So the problem that we have is how we solve the problem, which is linked with philosophy of parties or philosophy of the implementer, everything, right? So, and also include the community partnership. But depend on your philosophy, how you solve the problem, you will include or exclude people, and also not the process and then sell. And also, it's the solving the problem impact a lot the accountability and the community partnership. If you don't believe that you don't need all the parties or the way how you solve the problem, they could impact this. So it's a very, very complex, industries and also philosophies and public health, which is it has to work intimately with healthcare, but both have a different way to be accountable and partnership and where they move. One is more funding, the money, healthcare, and outcomes, of course, public health. It's different. So, but they need to work together and be
so that's
accountable and responsible.
Yeah, so that's partly why, as Susie, we'll try to lean in. That's partly why the Accountable Community for Health concept is so beneficial because it defines that as a priority. And Rob, I'm putting in the accountability statement that I made, accountable as evidenced by. And Susie will work on the phrasing to differentiate it and maybe get some more references just so that we can clarify that it's not just the Prevention Institute that uses that concept.
And the problem, sorry, Sarah, this is the last part. The problem is the way how, for example, public health defines success, and we know how today health outcomes, maybe they could be better, maybe they could be worse, but this community partnership accountability is so important because it's just it's a vast area to because it's a lot of resources involved that could be maybe more used effectively.
Thank you, Owen. Okay, I think I know my homework on this one. We know our homework. I think we got to community participatory design, right? And then the next one was community partnerships. And we know, so Susie, I totally understand, like regarding the previous slide, engagement, I like co-design, that's lovely. Lucy, I'm getting, I'm trying to figure out, again, I have to figure out a way to, I'm responding to Rob's statement, but as currently identified and defined, Accountable Community for Health does not have that final statement. So I'm just holding space. I'm going to do some research and see if there's the other references include the as evidenced by, more to come there. So on community partnerships, those are defined by Urban Institute as a collaboration between community members, organizations, institutions, or sectors that work together to identify priorities. Co-design, there's your co-design word. And co-design interventions and advanced shared goals related to health, safety, and well-being. The community development specialist is actually where the NACDEP is where we got our develop concept from. So community development specialists are a practice-based professional that promotes participatory democracy, sustainable development, rights, equality, economic opportunity, and social justice through the organization, education, empowerment of people within their communities, whether these be of locality, identity, or interest in urban and rural settings. So
Sarah, could you say practice-based professional who? We
Yes.
use who for people? Thank you.
Yes, I can.
This isn't going to be an AI project.
Okay. I love you, Lucy. I love it. Can do. On it. Okay, the next one is business improvement districts. Again, these are 5 working cross-sectoral, cross-domain community level interventions. Susan, before I get into business improvement districts, do you have a thought?
Yeah, that was the one I had a question about. How does that relate to health districts that are getting formed through assessing property, a parcel tax or property tax to actually improve health rather than just business improvement? Are you thinking of those together, or is that just another category under a business improvement district?
Can you tell me what help, maybe it's a missing concept. So what is the concept that you're speaking to?
Like a health improvement district. In California where we live, there is a mechanism to form these hospital districts or health improvement districts and allow the district, like 3 or 4 towns or a small region, to actually assess a parcel tax to be used for healthcare dollars. So it's a similar concept that you're generating revenue through a compulsory assessment on local property owners or businesses for the benefit of health. So I was just curious if this is a side-by-side concept or if it's an additional
It
concept.
have to be an additional one, and I'm going to try to answer. I hear you. So let's look and see. It seems like it's a gap, but so many of the things that we're doing, Lucy, in this work are structural, about built environment. The business improvement districts do have something to do with health, fundamentally, right?
Absolutely. Mm-hmm.
Yeah. So it's not that business improvement districts don't, it's that I think we're included by not including, again, I didn't even know that health improvement districts existed until now. I love it. I love it. So we will pull it in, you know. Is it just a California thing or is it other places?
I don't know the full landscape across the nation, but I believe there are capabilities like that, and it probably has a very specific name.
I
I'll
love it. I
I'll
love
do a
it.
little Googling and see if I can add anything to the chat.
Okay, fantastic.
What did you
Missouri
call it
did it
again,
too.
Susan?
Health Improvement District. Missouri did it too. Thank
Yeah.
you, Denise. Thank you. And then Owen, any thoughts before we go to our next slide
Yes.
again? Okay.
Yes, I think maybe one way is to have a scoring mechanism where make everyone responsible for everything. You know, you do your thing, but you are already also you have a percentage of responsibility in the well-being and the health outcomes, for example, or find a way, because if I am that hospital who created that district, well, that money originally maybe, I'm guessing maybe, was created to maintain or sustain basic infrastructure of this hospital. But that money should be linked with the well-being of the community as a percentage. In that way, other organizations, they do other services, not just health, but other services are responsible also for that well-being. So in that way, nobody is independent, just responsible for my little piece. And that way we all are responsible. So that's the hard part. You know,
I think that's what they're saying, the health improvement district or the health improvement area. I mean, luckily, we're going to come back. We don't have another meeting, but before you vote on the master list, we will see if we can find a national reference and definition for health improvement districts. Jonathan? Oh,
Hello, can you hear me okay?
yes, we can.
And so I mean, I think about this in back to our original conversation, right? So people need capital resources to actually help them address the social determinants of health, correct?
Yes.
Okay. And so
I mean, in some instances, they just need, other resources, the human resources, but yes.
well, so the ability to figure out where to invest their resources effectively has to start somewhere. And so the ability for quote unquote a civic ecosystem, a community or a city to look at all the pressing needs from a social determinant of health standpoint that they have in their ecosystem, the ability to invest the resources to address them, I thought was what we're trying to help them quantify.
And what this really, Jonathan, what is it, which of the comments does this relate to? Which of the concepts? I'm just trying to understand.
Back to the business part of it, right?
Oh,
Because
yes, I think we're, yes, I hear you there. Yeah.
So from an economic development standpoint, if I were going to move to Vermont to do business, then I would need to know that I had access to human capital and the resources to support that, right? So if I'm a software engineer, I don't need as much help as if I am a Starbucks barista. But at some point in time, we may all need to tap into that civic ecosystem to address whatever type of social determinants of health needs we have. So the ability for from an organization from a high level, from a systems level, to be able to look at it as a clinician, as a practitioner, as an individual, or as an economic development tool is, I thought, what we were trying to do. I could be overthinking it.
Oh, yeah, I think maybe, but also quite simply, like the kind of infrastructure that's required to move on community level built environment concepts is usually operationalized through business improvement districts, right? And I think I understand what you're saying, but like on the brass tacks, like my city's, redesign for downtown Burlington to support walkability, water runoff, and access to green space is a business improvement district project, right? It's like does that make sense?
It does. It makes perfect sense. It makes perfect sense.
Awesome. Okay. We're looking for, thank you for the references. We have Washington references, Missouri concepts, health improvement districts coming soon to a slide near you. Thank you so much, Susie. You should come all the time. It's so good. It's good to have you here. All right. Any other questions on this slide? Again, this is like the most again, I hear some, I have to change that to who? I hear trying to see if we can find accountable as evidenced by what for our accountable communities for health, and also there's a need to clarify it from other things. And honestly, if anyone knows a name for this, which is not accountable for community for health, please let us know. It's not AHC. So accountable for community for health is what with the term that I've heard used in the ecosystem for 20 years or so. And again, AHC made it a little tricky. All right, any other questions on this slide? Thank you for your robust conversation. I hope I'm trying to keep up. You brilliant people. All right, okay, next slide. All right, neighborhood safety concepts. Next slide. Next slide. Asha, do you want to go here?
Yes, I got it. Good afternoon, everyone. Okay, again, we have two standardized instruments in our neighborhood safety domain. We have the items from the National Institute for Justice, NIJ, measures of community perceptions, and neighborhood scale, the safety section. And if you would like to review those items, please go to Confluence and access the master, and you will see all of the screening items listed there for you. All right, nothing new to add.
Awesome. Okay, next slide. Next slide. We're about to add a set of community level concepts that have not been seen before. Again, because when it comes to within all of the domains, the need for the macro structural level definition of the problem and the need for macro level interventions was identified from the beginning as a requirement to do this domain justice. There are historically in our domains, we saw this again in systemic racism as an example, or in transportation insecurity, when there are interconnected domains, when one thing is affecting another thing, we've called that in. We do it very carefully when we can support it by the literature and when we know it to be true. So we have talked about the systemic racism concept before. Systemic racism affecting neighborhood safety is a new concept. Again, not just wanting to name the problems, but also wanting to name some of the sources. Inequitable distribution of wealth affecting neighborhood safety. Adverse exposure to poor. I thought we sunset that one. Adverse exposure of poor health and well-being affecting neighborhood safety. I'm tripping over that one because I thought that one was retired. Limited healthcare access affecting neighborhood safety was clearly identified as something that was significant. And then this all comes from the literature, we presented to you like in previous meetings. Over reliance on the criminal legal system affecting neighborhood safety. These are all drivers of neighborhood safety concerns in the literature that we are naming. And we'll figure out the adverse exposure one. I might just be misremembering, but I thought it was demoted. More to come there. Next slide. Next slide. On goals. Oh, hi, Owen. Yes.
I just have a quick question in the previous slide.
Yeah.
So the problem with this, when you try to look at that community level and systemic racism affecting neighborhood safety, is how you tackle that, or how and who is supporting that and who is not supporting that, right? Also because there are I don't know what would be the solution, but there are like a limited health access affecting neighborhood safety. I think that's a good one because describing the problem, how it is, and maybe the systemic racism is. I am not saying anything about this, but what I'm trying to say is people who try to address this, it's like go in the mountain Everest. So I don't see there are other
We did
Um,
address, the one thing, Owen, is we did cover topics in systemic racism in our racism work this spring. And so there's,
oh, okay,
yeah,
okay.
so there's precedent for addressing it and naming it and the strategies. We like, yeah, there's, it's like this, it's like that game of like the links, right? So when we use a concept, we have to like be able to like support it. And
I
the good
see.
thing, yeah. So,
I'm on board. Okay, thank
okay,
you.
awesome. I love it. Sarah Bahal's gathering rate. I mean, Sarah Bahal, you're a genius. Thank you so much. All right. Again, I think we've collectively recognized that the adverse exposure, I think that one was supposed to be sunset. I think I didn't catch it, or at least we're all seeing it and it's feeling a little awkward. So more to come there. Next slide. These are new goal concepts. Again, we have social cohesion, which is kind of the community level finding of social connection, experience of mutual trust, shared norms and strong social connections, creating a sense of belonging and collective responsibility for the well-being of the safety of one another. We do know developing social cohesion and belonging is a really critical goal for neighborhood safety. We have your civic muscle here, Lucy. We brought it in. I hope you feel seen. The special capabilities of people and organizations that convey to all a sense of being a part of community and having the power to shape their common world. The way we were framing this earlier was that it's kind of a combination of social cohesion and like in social agency and power. Civic muscle, so critical to the vital conditions framework and the equitable plan for long-term recovery and resilience that the cross-agency federal entities produced last year in 2023.
Thank you for recognizing that, Sarah, but the thumbs up was actually for social cohesion.
I know.
think.
The
Okay.
timing. I know
Okay.
the way you work. Yes, I am aware. And then so this is again the goal across green space and across neighborhood safety that's able to access fulfilling green space. It exists when all residents, and this is like being out in the world. So this exists when all residents have equitable access to public green spaces such as parks, gardens, water features, trails, and open natural areas that are safe, inclusive, well-maintained, and conducive to physical, emotional, and social well-being. This was a prudence choice because we just had safe green space here, and then we had able to access fulfilling green space over in access to green space. We didn't want to build both, and we felt like this was a way to be frugal and prudent. Next slide. Whew, we have a lot to get through, and it's 5. I got this. We got this, Sasha. Okay. I'm just naming. There's still a lot to come. Next slide. All right. So we wanted to level set. Everything you're about to see was covered in the brilliant presentation in August by experts from Prevention Institute on the evidence-based model, public health pathways to preventing violence. And because when we did our first review a couple weeks ago, or like 3 weeks ago within SMEs of our existing domains, existing programs, we had a lot of micro person level programs and had yet to name the structural and macro things that mattered. And so we went through and we built and pulled in concepts that represent all of those community level macro concepts that are evidence-based to drive towards violence prevention and neighborhood safety. Next slide. And again, you can watch, if you want to refresh yourself on the model, it was brilliantly presented in August and we have the link there. So these again are macro. These are things that are evidence-based and we have definitions coming, but these literally just bloomed this week and so it's been busy. Fair housing, living wage, voting rights, voter enfranchisement, voter registration, fair elections, drug policy reform, treatment court programs, harm reduction policies, and restorative justice programs. I know. Sit with that for a bit, and there's going to be more to come, right? So when it really comes to like, what do we do to address neighborhood safety concerns? I know, Lucy, and this is just the beginning. Just the beginning. The evidence says focus on these. And oh, and this relates to what you were saying before, right? It's like we have to do these things to get to the goals we want, right? Okay, so next slide. Green lining. the opposite of redlining, inclusionary zoning, anti-racism programs, unconscious bias training. We pulled in, because it's the best example of it, the racial and ethnic approaches to community health programs, reproductive justice training, fair lending, gun control policy, which for us means everything from assault weapons bans to background checks, and because we're trying to be inclusive because they all matter in the lit, and then crime prevention through environmental design. Oh, anger, yeah. And we didn't find that in the lit, but we appreciate that, Lucy. I know, I understand what you meant. Okay, next slide. Next, and we have affordable housing strategies, anti-displacement strategies, violence interruption programs, social emotional learning, universal pre-K, and mobile crisis services. These are macro level interventions aligned with all of the evidence and things we know to address neighborhood safety structurally. Pretty powerful stuff. Thank you, Jonathan. Develop or maintain or refer to, if that's what you mean, Susan. These are our program concepts that will get wrapped around our syntax. Is that what you're meaning?
Yes.
Yes. We got you.
Exactly.
Yeah, we got. And that's why we had to create those develop and maintain concepts, because from a macro level perspective, if you do not have a universal pre-K program in your community, you have to make it, right? It's not enough to, like, there's nothing to refer the person to until it exists. Okay. Feels like these are sitting well. Again, the definitions are coming. These all just bloomed, and just grateful for the wisdom, like Sarah Bahal and Asha and all the folks. But Sarah and Asha work really hard on this behind the scenes, and just thank you. Amazing concept, friends. All right. Okay. I think we're ready to move on. I'm sensing, like, Susie, hi.
Very brief question. I was
Yeah.
really, first of all, this is brilliant work. I was intrigued by the greening space and the fulfilling greening spaces. But one thing I've really noticed is the difficulty to get to be safe in a neighborhood when you're trying to get food, when the
Oh,
only
yes.
food in the neighborhood is the liquor store, and it's kind of the hangout place
Mhm.
for other activities that go on at the, at sort of that kind of a small market when there's not other fresh food or other good grocery options in a community. Is there anything about connecting neighborhood safety to access, sort of safe access for food?
We did have
Or do you,
we
you
did
may intentionally have put that somewhere else?
Well, that's actually a really good thought. So we did have in our previous presentation on the master existing, we have alcohol policies about actually reducing alcohol, about the stores themselves. We had in the beginning, we created all of these binding things related to all of the social determinants of health and neighborhood safety. And our SMEs very carefully winnowed it to just the ones that they could defend in the lit. So that's not to say the food insecurity and food access concerns don't relate to neighborhood safety. They weren't called in specifically, but the alcohol thing was, right? The availability of it's like instead of like a food swamp, like an alcohol swamp. There was a lot of conversation in the lit and by the SMEs in that. And Asha, I don't think I'm forgetting anything. I think we focused just on the ones that we could defend. Correct?
That is correct. That's the approach we took.
Thank you.
Asha comes in. I'm sorry. Oh, yes, exactly. Yeah, and we're very careful if it's not distinctly, like, so Rob, thank you. If it's not specifically linked in the lit, we're like, you can define food access separately, and we will in a couple seconds, and then you can come back, you can link them. Oh, and before we go on, yes?
Maybe that will answer what somebody asked, made a comment just a second ago. we don't, maybe we don't have something about community economic prosperity program. Because when you have
Oh,
economic
yeah.
prosperity, they generate funding, they generate business, they generate good jobs. Some rural areas, sometimes the leaders maybe don't want too many new companies coming in because that will impact the salary of the people who are being paid in that area, which generate poverty,
Yes.
generational poverty. So,
So we have
but
specific.
this is complicated.
No, I
but-
hear you. I hear you. So we have, if we can, Owen, can you look for a reference and a thing and send it to us by email on that? That'd be great.
Yeah, community prosperity program, something. Okay, yeah.
Yeah, that sounds great. Go for it. Thank you.
Thank
You're
you.
amazing.
Thank you for the homework.
I love it. I love us. I love ours. You guys are the best. I'm so grateful for all of you. All right. Okay, I think we're getting ready because what we had, Owen, was specific strategies to generate wealth. Like we had universal basic income, we have living wage. Oh, baby bonds. We forgot baby bonds. Okay. Baby bonds coming soon. Forgot it. Okay, because that's my friend Patricia Salibi was talking about baby bonds last time, and that's a wealth generator as well. But a collective program about community prosperity we hadn't named yet. So Owen, thank you for calling that in. Looking forward to reference in the email soon.
You need money to pay for all these programs.
I know we do. Next slide. All right, so the importance of cultural healing and was really well represented in the model. And there really was no better, I'm getting really emotional. There's no better way to name cultural healing than what we learned from Dr. Sangwook Ulrich in our work in protective factors on the cultural indigenous connectedness framework. So the aspects of cultural healing and cultural wellness were defined in that model as cultural connectedness. And again, these all have definitions. We just haven't pulled them here because we define them all in protective factors and ACEs. Cultural connectedness, intergenerational connectedness, environmental connectedness, spiritual connectedness, family connectedness, community connectedness, and mindfulness. Right, so those are all, again, trying to pinpoint on the model that cultural healing aspect we already had the wisdom of Dr. Sangwook Ulrich to look back to. Community Mental Health Center, again, they are one of our amazing SMEs as a leader within CDC tripped upon this, and I'm wondering if the framing is odd, but it's meant to represent every single county, like health service area in the country's approach to mental behavioral health. We're working on that. With that came up, I think, through actually our program classification and program enhancement work. So that's called in because it matters as a community mental health access, but the phrasing, we're just going to look at the phrasing there. We had some community-based reentry program. We had that existing through incarceration. And then we called in faith-based leaders here because the importance of faith and cultural connectedness was clear within the model, and we hadn't named faith-based leaders yet as a profession that mattered. And so we called them in and trying to be as inclusive as possible. All right, next slide. Whew. Neighborhood safety. That's just such a gorgeous work. And again, thank you to the amazing model that drove it as we looked at macro level concepts. We have a bunch left to do. Oh, shit, let's see if we can get there. Luckily, there's not a ton of new content. Neighborhood safety, as I mentioned at the beginning of the call, had most of the new content because of trying to fill those macro concept gaps. And that was everything you just saw. Okay, next slide. Owen?
Japan have in first to third grade, they don't grade the kids, but they teach them to be humans, to be good humans.
We have the social
Right.
emotional learning in our list.
They clean the school, they do everything, and
Yeah.
and they clean. That's the reason why Japan is so clean, because they teach them. I think that it could be a best practice there, model, pilot. But I don't know what is the name of the best practice, but I can look at it. But most people know about that now with social media.
Thank you so much. And so if you can find a reference there, please send it to us. That sounds lovely.
Okay.
So on to food access, there's not a ton of new stuff here, but there's some clarity here because of once we try to start creating definitions, we realize sometimes that things have to be subdivided. And you're going to see that in the next slides. Next slide. This is the Usher model of food access, including acceptability, accessibility, accommodation, affordability, and availability. You will see the Usher dimensions weaving through our food access definitions as we go forward. Next slide. Very similar to how we did the food insecurity work. Next slide. Asha, go you.
Right,
Names.
I got it. All right, so for food access, again, I'm going to give you the disclaimer. If you would like to review all of the items in these standardized instruments, please pull them down off of the master file on Confluence. But what we have so far as standardized instruments are the items from the Wellbeing and Basic Needs Survey, items from the neighborhood scale, availability of healthy foods, fruit and vegetable community assessment tool that comes to us from CalAIM. We have the nutrition environment measure survey, which is new, and I'll review that on the next slide. We have the perceived nutrition environment, or NEMS-P, food environment survey. And then we also have the USDA community food assessment toolkit, food store survey instrument. And just to dive in a little bit deeper into the Nutrition Environment Measures Survey, or NEMS, it is a community food access assessment tool that can be used at the community level to really assess food access along different measures. There's one for milk, there's one for produce, there's one for meats, and so on and so forth. And what this just provides is it paints a really broad picture of the community food access in a specific community, identifying what the local resources are that either support or hinder food access. So our SMEs felt like this was very important to highlight in the domain. And that's it. And then we can move on to our data sources.
So Michelle's asking a good question, like, how do we find our instruments? And then she also asked, do you include proprietary tools? And yes, we do. We do include proprietary tools. We try not to just have proprietary tools, but we include, and then, so we, if there's an instrument we seem to have missed, let us know. But we leverage our SMEs as experts in defining what instruments that, they feel are important. And then we also leverage an extensive lit review that is, like, Asha leads that, like, before we even kick off a domain. And then that's the pre-lit review. And then we're constantly folding in lit as we go through our domain, right? So because every new concept creates a new possible set of search terms. So we are continually, and then Michelle, you're doing a great job. And we're gonna try to finally publish our process paper, like the How We Do What We Do secret special sauce paper. So super excited about that. And then Quantrela's asking if we include our food pantry assessments as well. And we are focused on the marketplace interventions, like places where people can consume food, as opposed, that's why you saw in the community food assessment the food market part of the survey and not the emergency food system. And then Michelle, do you have any other thoughts? No. You know where to find me, buddy.
Listen, go ahead.
You all set? She's all
Okay.
set.
Okay. And then I just wanted to add, the USDA food assessment tool does have a food pantry assessment module in it.
Correct. And that's why we're only focused on the food market one, because we were focused on, we're not trying, yeah, Exactamundo. It's a gorgeous thing. Yeah. Okay. Next slide. This has not changed. Still resting on the low access data element, but there's some updates there in the concepts. Next slide. Updates here, based entirely on needing to define things. We try to get you definitions when we vote before the vote. So a couple things happened when we went in to create definitions. Number one, we recognize that based on the low access, the Food Access Research Atlas, there are 4 different possible metrics you could arrive at there. There are 2 metrics for rural and 2 metrics for urban, right? So the first requirement was to clarify low access to food markets in rural census tracts based on the USDA Food Access Research Atlas, and low access to food markets in urban census tracts based on the USDA Food Access Research Atlas. The next thing we had to determine was within each rural and urban census tract, there are 2 different metrics that USDA defines. There is a short distance and a long distance. And so what we decided, just again, to be determined if this is sufficient, but out of a point of prudence, we're starting with the one that includes the most people, right? So the one that is most sensitive, right? Because so for rural, it's 10 and 20. So we included 10 because you'd get the most number of people in who is 10, who are more than 10 miles from a nearest supermarket. And same thing with urban, it's the half-mile mark. We could do all 4. We could do rural 10 and 20, urban half-mile and a mile, right? But right now we're just starting with these 2. Our SMEs will help us figure out what to do next, but all 4 possibilities exist. Does that make sense? I think it probably makes sense. We only had 1, and that was not good because there's 4 possibilities. We also had to create a general concept for low neighborhood food access that we can use in our syntax throughout the rest, and it's based on Usher. It's based on Usher, and it's based on the method we used to establish the food insecurity definition in 2019, which is limit access to acceptable, accessible, affordable, available, and/or accommodative food in your neighborhood. Right? That just came off the press. I am sure there are grammar problems. It will be refined, I promise. But what we can imagine doing is taking out food and putting in produce, taking out, right? So that we talk about different types of food requirements, we needed to create a base definition. And so you can see that happening in produce, right? Nothing else has changed right here, but we had to split into rural and urban, and we wanted to create a meta concept for low neighborhood food access. Okay, next slide. 520. We talked about those joined concepts in the past. This is an evergreen one. This one came out in transportation insecurity. We did have an end-to-end review comment on the intersection of transportation insecurity and food access because it weighs heavily in the Food Access Research Atlas methodology. Access to transportation is one of the variables you can filter to. We're sticking with just the food access concepts for the Food Access Research Atlas, but this one is so important and it already exists. We made it in transportation insecurity, so our SMEs wanted to bring it in. And thank you to, I think it was our dear friend Bill Swan who raised that as an end-to-end review comment. Thank you for making sure that we included that and went back. Next slide. Whew. They're all, nothing new here, all in the master file. Nothing to see. Okay, next slide. Next slide. All right, so there's not a ton new here either. In order to get to the accommodation variable in Usher's model, we really are trying to figure out what that looks like, right? And we've been thinking about it through lenses of, low sensory hours, senior-friendly hours. So this one made it to the top because we do know that many markets have accessible hours in the early morning for seniors, and it's an easy concept. It's a universal nationwide concept, and it's easy to define. So this came.
I brought that up.
Oh, you did, Janice.
Yeah.
You're great.
Yay!
Yay! Good job, Janice.
I'm
You're
gonna
the
take
best.
a clap. Yeah.
I love it. All right, next slide. Ooh, here we go. Green space on let's see if we can do it. We might be able to, we have 8 minutes. We'll see it. Next slide. Next slide. Okay, Asha, it's you, bub.
All right. Yeah. So we, again, if you want to review these instruments in full, please go to the master and pull the Confluence and pull down the master. But our standardized instruments come from the Wellbeing and Basic Needs Survey and the Adults, People, and Nature Survey for England, because it contained assessments for blue spaces and wild spaces as well. And that was important to our SMEs to include. So that is that. That's all we have so far there.
It's important to me.
And important to Sarah.
I'm such a, I don't usually name my own requirements, but I was like, I love lakes. All right. Next slide. Here we go. Next slide. This has not changed. Park Serve CDC Tree Equity Score. So gorgeous on the master. Nothing new for diagnoses and access to green space. Please see the master file for current goals. You can see we were truthful. Neighborhood safety had the most new concepts because of those macro and structural level interventions. That's also why they're first. Next slide. No new goals for access to green space. They're all on the master. Next slide. We do have new interventions. Next slide. Again, we had a lovely conversation on the professions that matter when it comes, professions and programs that matter when it comes to achieving this goal. And there's all kinds of fun new people and programs. Forest landscape management, park landscape management. One of my favorite professions, community arborists. I love me a community arborist. Landscape architects, urban regional planning. We included Department of Public Works because we're trying to define like all the voices that matter when it comes to parks. We simplified, we had native plants as fire hazard prevention in there. It was really too complicated. And so we really just talked about, we realized that it was all about design. And so landscape design is a meta concept and we're not sub-specifying different types of concepts there. We are adding physical activity equipment programs because, I think I've talked about in the beginning, like oftentimes or green space renovation includes physical activity, intentional development for pull-up bars or different activity stations. We also have, so landscape design is in the native plans as fire hazard prevention. It's half of the concept. And then we have risk mitigation really as a meta concept when it comes to green space intervention, because we talked about all the different ways you can manage risk with green space design, whether it be water hazard, water risk, runoff risk, fire risk. And so we built risk mitigation and fire mitigation as a subtype, just trying to keep things super simple. Next slide. Oh, that's it. Asha, Manuel. Oh, and hi, we did it.
Don't think about that. I don't have a question. Just kidding. Sarah, I comment before indoor green spaces.
Mhm.
We talked about, you were talking about the
Right. But also
yeah.
I have another thing. I live in Florida and Utah. Utah have a lot of green spaces. Florida also, but some communities in Florida, for example, the community rec, like in Tallahassee, for example, you don't have really one community rec like how we have in Salt Lake, that we have many. So, I think parks are good, the green are good, but family needs in terms to recreational community rec, I think that are very important. I don't know any best practices, but I think Utah is pretty healthy in the health outcomes, usually in the ranking, among usually 1, 2, 3, 4, 5. But my comment. You already have that?
Well, not really. So it's part of our initial scoping when we enter a domain. We just try to figure out what the boundaries are, right? So we talked a lot about physical activity, walkability, those kinds of goals. And it was like, that's an important thing. It's not directly this, right? So if it's just about exercise, it was not addressed in this domain unless it was outside addressing the access to green space and blue space and nature requirements. So inside recreational spaces, we're not in this work, by our SMEs, we're not in this work. Does that make sense?
Mm-hmm.
But scope for future work, This is like we're, you know, the unending list of things that we could possibly address. Okay. I think
Thank
I think I answered that question well. It was a long meeting. All right, next slide. Next slide. All right, buds, super friends, folks who came to an asynchronous meeting on a Thursday afternoon. Our next meeting on this topic will be the vote. Send in your end-to-end review comments. There's some specific, we gathered, Asha's the amazing note taker. I saw her taking notes. Owen, you have some specific end-to-end review homework sending us the things you mentioned, right?
Yes.
We have missing programs, the community health improvement thing. And then I'm going to look at some of the definitions early in those macro level programs. Otherwise, submit your comments, expect masters on Tuesday evening, and then we'll see you in 2 weeks.
I think the definition, the macro program, one solution could be is you have that master definition, and every sector, like healthcare, have an appropriate and link it to that definition based on that definition, but they
You
create
mean
their own.
yeah.
Because it's really complex to have one definition for all the community, all the partners. It's
Yeah.
complex.
I know. That's a good idea. We always try to do simple, like broad parents and more specific children. Okay. John, I'm going to ask one really good question before we go. Next week, we're getting technical and we're getting enhancements on, we're meeting in next week to talk about implementation and bill considerations when it comes to the program classification work that we completed in the spring. So classification of social care programs for the purposes of navigation and connection to services coming soon to you next week. Fun times. And so please come and see us then. So sure, everyone. And we will see you, our subject matter experts from that work, our members will be there. And then 2 weeks time, November 20th is the vote. It's so good to see you all. So grateful to see old friends. Susie, thank you for coming. You're coming in so wise. And we will see you in a bit, either next week or the week after. Bye.
Bye-bye. Thank you all.
Thank you.